Hello again, this is Dr. Scott Pirochta from Hld Dentistry. You never know where good information is going to come from, and we have a periodical that we get for internal use that's it's called Insurance Solutions, and it is meant for Cinda and Mallory up front, and it helps them in insurance billing. And right in the back of their magazine, they have a really short but potent article about diabetes. And it's one we've been talking about quite a bit, and I certainly will talk with my patients about it quite a bit. It was a study that was done at the Maryland State Office of Oral Health and in conjunction with the University of Maryland School of Dentistry. And just in a nutshell, it says 70% of the U.S. population will visit a dentist at least once this year. I think that's high, but we'll take their word for it. Then they say 30 million Americans will see a dentist in a given year and not see their physician. I think that one is low, but we'll take that one for what it's worth. It's estimated that 27.8% of patients presenting in the dental office have either prediabetes or undiagnosed diabetes. 27.8%, that's upwards of a third of the population have either prediabetes or diabetes. The article references a two-way relationship between diabetes and periodontal disease, and we've known that for quite some time, meaning periodontal disease affects in a negative way diabetes, and diabetes affects in a very negative way periodontal disease. Another very interesting number is that 50% of all diabetics do a very poor job of controlling their blood sugar. Poorly controlled blood sugar results in microvascular damage. Microvascular damage means destruction of organs, of eyes, certainly has cardiovascular ramifications, heart disease and stroke risk, but it also is a very significant player in dementia and Alzheimer's. The crux of the article is, and I'm going to read this, is that a number of published studies have demonstrated that screening for prediabetes and diabetes is feasible in the dental office with significant acceptance by patients. We know this. We have an A1C machine, and so in 6 minutes we can find out your status with a very high probability. And we have been for over a year now doing A1C readings for patients. And so for $30 in 6 minutes, you can find out where you are with respect to diabetes. Are you one of those 30% of the people who are walking around either undiagnosed diabetes or pre-diabetes? Unfortunately, we've had a lot of patients who are diabetic. I don't treat diabetes. I can make patients aware of diabetes, and we can certainly, with the patient's permission, report that information to their physician so they can seek treatment. Diabetes is very controllable with diet, with exercise, maybe with medications, certainly weight control. All of those can very positively affect diabetes and keep diabetic neuropathies and microvascular damage to a minimum. Fortunately, there are a lot more patients that we see who fall in the pre-diabetic or even borderline diabetes category that can keep themselves on the good side of the diabetic fence. And those are the patients who are most appreciative of our efforts. By a little bit of counsel, they can make some changes in their diet, in their exercise, in their weight, and bring that number down and stay farther away from the diabetes diagnosis. It's one of the easiest and one of the most gratifying things that we can do in the dental office. This directly affects longevity, and it certainly affects activity and people's ability to stay active and healthy. I care deeply about all of my patients, and it's my hope that all of my patients see their physician or their primary care practitioner regularly. For those who don't, we are always on the lookout, not only to keep them healthy from a oral health standpoint, but also to do whatever I can to keep them healthy from their body, mind, and soul. This is Dr. Scott Pirochta from Healthy Life Dentistry, and I want to be a partner in your overall health care.